Doc, if I take this Zepbound thing, can I stop using CPAP? And most people expect a sleep physician to defend his machine. I told him yes, possibly. But before I give the answer, I remind him. CPAP is a disease-preventing and life-saving treatment, and quitting it is serious. It takes patience, discipline, and a team effort, starting with your spouse, your physician's office, your weight management team, and your CPAP provider. If we haven't met, I'm a sleep doctor from Indiana's Amish country, 30 years, thousands of patients, helping them reclaim energy, intimacy, and life through sound sleep. And today, I want to walk you through the 5-step protocol which my clinic uses. So here it is, 5 steps and a bonus at the end. Step 1 is going to surprise you, and step 5 is a single number. And it's the only thing that actually settles this. Now, step 1, keep using your CPAP. I know, you came here to hear the opposite. Your CPAP works through the first night you put it on. The medication takes months. You start on a small dose and step up every 4 weeks, then the weight has to come off. Then the airway has to respond to that. And here is the thing nobody tells you. There is no meter on your nightstand for this. You will not know what your throat is doing at night until somebody tests it again. So you keep breathing well while you wait. Keeping CPAP on isn't the obstacle to quitting. It is the fastest way through the quitting process. Step 2, find out if you qualify based on your apnea-hypopnea index and BMI. 469 people were in that trial, and they all had 2 things in common. First, apnea-hypopnea index. Number of times your throat was collapsing, shutting off, and your breathing was stopping or becoming shallow per hour. Everyone in the trial was at 15 or higher AHI. The average participant was around 50 AHI. Second, they all had a BMI, body mass index, of 30 or above. Let me give you a rough idea about this. At 5 feet 10, that's about 209 pounds. At 5 feet 4, about 175. If AHI and BMI, both of these describe you, keep watching, because the next 3 steps are your roadmap. If they don't describe you, stay anyway, you'll get benefit. Roughly 2/3 of people with sleep apnea are not obese. And for them, weight is not what's closing the airway. It's the shape of the jaw, the size of the tongue, the way the breathing control system behaves at night. No medication can change that. Step 3, use CPAP and Zepbound together for the first year. Here is the reason. Zepbound is approved specifically for moderate to severe sleep apnea in adults who are also living with obesity. Of the group in the trial who were already using CPAP, about half met the study's definition of no longer needing CPAP at 52 weeks. Average breathing events dropped roughly 60%. That's about 30 fewer interruptions in every hour of sleep. And I want you to hear this, the other half, because nobody puts it in the headline. The other half still had enough sleep apnea to need treatment. Not a little, but enough. So this is a coin flip with good odds, not a cure. Everyone in that trial also received a weight loss program alongside the injection. And the study was funded by the company that makes the drug. But the numbers are real, and they were confirmed on sleep studies. And they are the reason my answer to my patient was yes, possibly, instead of no. Step 4, lose the weight. Know the number that earns you the test. In the trial, the people who got there lost about 18 to 20% of their body weight. For a 250-pound man, that's roughly 45 to 50 pounds. And here is the part I want you to write down. The American Academy of Sleep Medicine says a repeat sleep study is worth considering once your weight has changed by 10 to 20% from where you started. That's the trigger. Not a feeling, not a season, a percentage. So track it. When you hit it and it holds, you earn the conversation. And know this going in, the benefit lasts exactly as long as the weight loss does. If the weight comes back, the apnea comes back with it. I watched that happen more than once. That's not a reason to avoid the medication. It's a reason to treat this as a change you are making rather than a course you are taking. Step 5, repeat the sleep study of the machine. This is the number I promised you, not how you feel in the morning, not the scale. And let me be straight with you about something first. There is no official published protocol yet for stopping CPAP after one of these medications. The drug is that new. What I'm giving you is how I do it. My fellow physicians do it because it is built on the standards we already use. The test has to be done off your CPAP. A night on the machine tells you the machine works. It tells you nothing about how your throat will behave without the machine. The bar that researchers use is the same bar I use. Breathing events under 5 an hour or between 5 and 14 with a score of 10 or lower on something called Epworth sleepiness scale and nothing else going on with your heart. Ask your doctor for the Epworth or find one online. It is quick and simple. I've had patients feel absolutely fantastic on the medication and still hand me a report full of breathing events. How you feel and what your airway is doing don't always move together, and only one of the two shows up on the paper. So if you have crossed that line, I'll be the first person in the room to tell you to stop CPAP. My clinic celebrates such successes. And if you haven't crossed it yet, you are not back to where you started. You are lighter, you are healthier, your pressure setting probably needs adjusting downward. You have slept well every single night getting there. Remember, 1 billion years of evolution built a body that repairs itself every night as long as the air keeps moving. Medicine is finally getting some people there, a second way. That's genuinely good news, and I want you to have it. I just want you sleeping well tonight and beyond through that journey. And now the bonus I promised you. I go through all of this in my book, CPAP is Sexy, how weight and anatomy and treatment actually fit together and what comes back when you finally sleep. The first chapter is yours free at dryatinjaypatel.com/chapter 1. Go read it tonight.